Good morning. I want you to stay right where you are. Do not get up yet. Just stay there in your bed or on the edge of your mattress or wherever you are right now, because what I am about to tell you is best heard before your feet touch the floor. My name is Dr. Chen. I am a physician in internal medicine, and I have been a doctor for over 25 years. And this morning, I want to talk to you about something that happens to millions of seniors every single day, and that almost nobody addresses properly. That moment right after you wake up, when you swing your legs over the side of the bed, put your feet on the floor, and stand up, and your knees scream. Not always out loud. Sometimes it is that deep grinding ache that starts at the kneecap and spreads. Sometimes it is a sharp pinch on the inside of the joint that makes you catch your breath. Sometimes it is that stiffness, that feeling like the joints have been filled with concrete overnight. And you have to hobble for the first few steps, holding the wall, holding the bedpost, waiting for the joints to warm up, hoping they will, the way they usually do, after a minute or two. I know this feeling is familiar to you because I hear about it every week. From patients who are 68, who are 74, who are 81. Good people, strong people, who have carried their bodies through decades of life, and who now dread the first steps of every single morning. And I want to say something to you before we go any further. You do not have to dread them anymore. That is not a promise I make lightly. I am a careful doctor. I believe in honesty above everything, but I have seen this work over and over again with my own patients. Two things done in the 2 minutes before you stand up that take away most of that morning knee pain before you even put your weight on the joint. And today I'm going to teach you exactly what they are and exactly why they work, so that you understand them deeply enough to believe in them and consistently enough to do them every single morning for the rest of your life. Because once you learn this, you will never want to get out of bed without it again. Let us begin. Now, first, I want to explain to you why your knees hurt specifically in the morning, because this is the piece most people never understand. And understanding it is what makes the 2-minute routine make complete sense. Your knee joint is surrounded by something called a joint capsule. Think of it like a sealed bag that wraps around the entire joint. Inside that bag is the synovial fluid, the natural lubricant of the joint. Its job is to coat the cartilage surfaces, reduce friction, and nourish the cartilage. Now, during the day, when you are moving, walking, climbing stairs, getting up and sitting down, that synovial fluid is constantly being circulated through the joint. It is warm, it is moving. It is doing its job beautifully. But during the night, you lie still for 7, 8, sometimes 9 hours. The joint barely moves. The synovial fluid stops circulating. It settles, it cools, it thickens. And something else happens. In a joint affected by arthritis or age-related wear, the joint lining, called the synovial membrane, produces mild inflammatory chemicals overnight. Not because anything is actively injuring the joint, but because inflammation in an arthritic joint follows a pattern. It builds overnight when you are still, when circulation is low, and it is at its peak right when you wake up, right when you try to stand. So what you experience in that first moment of standing is the combination of cold, thick, unlubricated joint fluid and peak overnight inflammation in a joint that is not yet warmed up or moved. No wonder it hurts. No wonder it takes several painful steps before it eases. The joint is essentially being asked to perform before it has been prepared, and that is exactly what the 2-minute routine fixes. It prepares the joint before you demand anything from it. It warms the fluid. It moves the fluid. It reduces the inflammatory pressure, and it activates the muscles that support the knee, all while you are still sitting, before a single pound of your body weight goes through that joint. Now let me explain each part of the routine in detail, because I want you to understand not just what to do, but why each movement matters so you feel confident doing it, and so you know you are doing it correctly. The first thing is a technique I call the morning knee warm, and it is the most important thing you will do for your knees starting today. Before you even think about moving your joints, you need to warm them. Here's why. Synovial fluid, the lubricant inside your knee, behaves very much like oil. When oil is cold, it is thick, viscous, slow-moving. When oil is warm, it flows freely. It coats surfaces efficiently. It protects. Your synovial fluid is exactly the same. Cold morning synovial fluid is thick and sluggish, and it does not coat and protect the cartilage surfaces well. Warm synovial fluid flows freely, spreads across the cartilage, and reduces friction dramatically. So the first thing you do every morning before any movement is apply warmth to the knees. Now I know what you're thinking. That sounds like a lot of preparation, but it is not. Here's how simple it is. The night before, place a small towel in a Ziploc bag in the bathroom. In the morning, run warm water over it, or simply keep a microwave-safe heat pack on your bedside table. 30 seconds in the microwave the night before, and it stays warm under an insulated cover until morning. Place it on your knees for 5 minutes while you are still sitting on the edge of the bed. That is all. 5 minutes of warmth changes the entire character of your morning knees. I have had patients tell me this single step alone made a bigger difference than anything else they had tried. Because most pain relief approaches address the pain after it starts. This prevents it from starting in the first place. Warmth before movement every morning, without exception. Now, while the warmth is being applied, or right after, you begin the second thing, the seated movement sequence. And this is where the real magic happens, because movement before standing does something that nothing else can do. It circulates the synovial fluid. Remember that thick, cold fluid sitting in the bottom of the joint overnight? Movement is what stirs it, warms it, spreads it across the cartilage surfaces, prepares the joint for loading. And here's the key. When you circulate the synovial fluid before standing, you are distributing that protective coating across the cartilage before your body weight goes through the joint, instead of forcing cold, stiff cartilage surfaces to bear weight and grind until friction and body heat slowly warm them, which is what causes that first painful minute of walking. You prepare them first and then stand on a joint that is already ready. The difference is extraordinary. So here is the seated movement sequence. Sit on the edge of your bed, back straight, feet flat on the floor, both hands resting gently on your thighs. Exercise 1, knee extensions. Slowly lift one foot off the floor, straightening the knee as much as comfortable. Hold the leg straight for 3 seconds. Slowly lower it. Then the other leg. Slowly lift, hold for 3 seconds, slowly lower. Do this 10 times on each side. 10 on the right, 10 on the left. Slow, controlled, no rushing. Now why this works. When you straighten the knee and hold it, the quadricep muscle, the large muscle at the front of the thigh, contracts. And when the quadriceps contracts, it compresses the knee joint slightly. And then when you lower and release, the joint decompresses and draws fresh synovial fluid in like a pump. Compression, decompression. Compression, decompression. 10 times on each side, and already fresh lubricated synovial fluid is coating your cartilage. Exercise 2, knee circles. Still seated, lift one knee slightly off the bed so your foot is hovering just above the floor. Now slowly rotate the lower leg in a small circle, as if you are drawing a small circle on the floor with your toe. 5 circles clockwise, 5 circles counterclockwise. Then the other leg, 5 and 5. This movement takes the joint through a range of motion it does not get during straight walking. It circulates fluid into the corners of the joint, the medial and lateral compartments, the areas that often ache the most. And it gently mobilizes the tendons and ligaments around the knee, so they are not tight and cold when you stand. Exercise 3, heel raises. Both feet flat on the floor. Slowly raise both heels, coming up onto the balls of your feet. Hold for 2 seconds, slowly lower. 10 repetitions. This activates the calf muscles, which support the knee from below. It also pumps blood up from the lower legs, increasing circulation to the knee joint. And it warms the ankle tendons, which connect through chains of tissue all the way up to the knee. Warming and moving the ankle reduces tension on the knee more than most people realize. Exercise 4, seated quad squeeze. Feet flat on the floor. Simply squeeze both thigh muscles as hard as comfortable, as if you are trying to push the backs of your knees down into the floor. Hold for 5 seconds, release. 10 repetitions. This is an isometric contraction. No movement at all, just pure muscle activation. And it does something very specific. It heats the joint from within. Muscle contraction generates heat, and the quadricep wraps around the knee joint, so when it contracts, it directly warms the joint tissue from the inside. Combined with the external warmth from your heat pack, the joint is now being heated from both outside and inside simultaneously. Now that is a prepared joint. Now, after these 4 exercises, you pause, you sit for 1 more moment. You take 2 slow, deep breaths, and then you stand. Using the technique I want to teach you now, because how you stand matters enormously. Most seniors stand up by pushing backwards into the chair and levering themselves up, with the knee bearing all the force from the deep bent position. This is the moment of maximum stress on the joint, and this is what causes that sharp pinch as you rise. I want you to stand differently. Here is the technique. Slide to the very front edge of the bed or chair, as close to the edge as comfortable. Now lean your whole upper body forward, nose over toes, so your center of gravity shifts forward over your feet. Now push through your heels and rise, leading with your chest, not your knees. Let your legs straighten as you come up, but the driving force is your heels pushing into the floor and your chest rising forward and upward, not your knees pushing you up from below. This single technique change reduces the force through the knee joint when standing by 30 to 40% compared to the way most seniors currently stand up. Slide forward, lean forward, nose over toes, push to the heels, rise chest first. Practice this every single time you stand up, from any surface, bed, chair, toilet, sofa, every single time. Within a week, it becomes automatic, and your knees will feel the difference immediately. Now, let me talk about what else you can do for the rest of the day to support what the morning routine has started, because the morning routine gives your knees a head start. But what you do during the day either supports that or undoes it. The first thing is movement breaks. Every 30 to 40 minutes during the day, if you have been sitting, stand up, walk for 2 minutes, and sit back down. These micro movement breaks do 3 things. They keep the synovial fluid circulating, they prevent the inflammation from building up again during stillness, and they maintain the warmth in the joint that you worked to create this morning. Many seniors sit for 2 or 3 hours at a stretch, watching television, reading, and then wonder why their knees are terrible when they finally stand. The joint has gone cold and stiff again, and the inflammatory pressure has rebuilt. Break that cycle. Every 30 to 40 minutes, 2-minute walk, then sit back down. Your knees will remain in a much better state throughout the entire day. The second thing is water. I am going to keep saying this because it is fundamental, and most seniors are not doing it. Synovial fluid is largely water. When you are dehydrated, even mildly, the fluid in your joints thins. It lubricates less effectively, and the cartilage surfaces experience more friction. 6 to 8 glasses of water throughout the day is joint medicine, free joint medicine that most seniors are walking around without. The third thing is your evening routine. Most people do the morning routine and then forget about their joints until the next morning. But there is something you can do in the evening that dramatically affects how your knees feel the following morning. And it takes 5 minutes every evening, about an hour before bed. Lie on your back on your bed and do 5 minutes of gentle knee movements. Heel slides, slowly sliding one heel up toward your buttocks, bending the knee as far as comfortable and slowly sliding it back down. 10 repetitions each leg. Then ankle circles, 10 each direction on each foot. Then gentle quad squeezes. 10 repetitions, 5 minutes. What this does is circulate synovial fluid one final time before the long overnight stillness. It clears some of the inflammatory compounds that have built up during the day, and it leaves the joint in a slightly better state going into the night, so that when you wake up in the morning, the starting point is better. Less inflammation has accumulated, less fluid has stagnated, and the morning routine has less work to do. Morning routine plus evening routine together is where the real transformation happens. Now let me tell you about something that can amplify everything I have described from the inside, because all of this is mechanical, external, movement and warmth. But there's also something happening at the cellular level inside that joint that we can support nutritionally. And I want to be practical and specific for you. The first nutritional support is turmeric with black pepper. I say this in almost every video because the research is that strong. Curcumin, the active compound in turmeric, blocks the specific inflammatory pathways called COX-2 pathways that create the overnight inflammatory buildup in arthritic joints. If you take curcumin with black pepper for the piperine that increases absorption 500 milligrams twice a day, you are directly reducing the overnight inflammatory tide that is responsible for most of your morning pain. Some of my patients have found that starting turmeric combined with the morning routine reduced their morning knee pain by more than half within 3 weeks. The second nutritional support is collagen peptides with vitamin C. 10 grams of collagen peptides every morning with 500 to 1,000 milligrams of vitamin C at the same time. This combination provides the raw materials for your cartilage cells to rebuild the collagen mesh that has been thinning with age. The morning routine maximizes the circulation to the cartilage, which maximizes the delivery of these building materials. The two work together. Movement brings the nutrients in, the nutrients rebuild the tissue. The third nutritional support is omega-3 fatty acids, fish oil, or flaxseed oil. 2 to 3 grams of EPA and DHA combined per day. Reduces systemic inflammation, including in the joint, and reduces the production of the inflammatory chemicals that the synovial membrane makes overnight. Less overnight inflammation means less morning pain, means the morning routine has less to overcome. Now, I want to address something that I hear from seniors that breaks my heart a little every single time I hear it. I have been told there is nothing that can be done for my knees. My doctor says I just have to live with it or wait for surgery. I hear this and I understand why a doctor might say it in a busy clinic with 10 minutes per appointment. When the focus is on surgical options or pharmaceutical management, the conversation about what patients can do themselves often does not happen. But I want to be honest with you. The research on morning knee pain management in seniors is clear. Thermal preparation of the joint, preloading movement before weight bearing, specific standing techniques, targeted nutritional support. These are not fringe ideas. They are supported by published evidence, and they work. Not for everyone, not perfectly, But for the majority of seniors with morning knee pain, meaningful improvement is achievable without surgery, without injections, without more medication. You have not been told this. Not because it does not work, but because nobody had the time to tell you. I have the time, and I am telling you now. Now let me give you everything in one clear summary, because I want you to walk away from this video with a plan so simple that you can start tomorrow morning, without buying anything, without preparing anything, without a single piece of equipment. Tomorrow morning, before you stand up. Step 1, apply warmth to your knees. Heat pack, warm towel, whatever you have. 5 minutes. While sitting on the edge of the bed. Step 2, do the seated movement sequence. Knee extensions, 10 each side. Knee circles, 5 each direction each side. Heel raises, 10 repetitions. Seated quad squeezes, 10 repetitions. 2 minutes. Step 3, pause, breathe. 2 slow, deep breaths. Step 4, stand up correctly. Slide to the edge, lean forward, nose over toes, push to the heels, rise chest first. That is it. 7 to 8 minutes total. From the moment you sit up to the moment you are standing with a joint that has been warmed, lubricated, activated, and ready. Instead of a cold, stiff joint being forced to bear weight before it is prepared for anything. The difference in how those first steps feel is something you will experience tomorrow morning. And I want you to come back and tell me about it in the comments, because that is the moment I love most in medicine. The moment a patient realizes that something they thought was permanent is not. That something they had accepted as just the way it is now can be changed with knowledge and 2 minutes every morning. Now let me tell you when morning knee pain needs medical attention, because I always want to make sure you know the signs. If your knee is visibly swollen when you wake up, swollen enough that you can see it is larger than usual, please see your doctor. If the knee is hot to the touch, not just warm, but noticeably hot, that warrants evaluation. If you have fallen recently and the pain is new or significantly worse since the fall, please get that examined. If your morning pain does not ease at all after 10 to 15 minutes of gentle movement and you cannot bear weight comfortably, please do not push through it alone. Seek medical guidance. And if the pain has been rapidly worsening over the past few weeks, rather than being a slow, familiar ache, that pattern of change should always be assessed. For most of you, this morning routine is safe and appropriate to begin tomorrow. But if anything I just described applies to you, please call your doctor first. Your well-being comes before any routine. Now, one final thing. I want to talk to you about something beyond the knees, because this video is about knees. But what it is really about is your morning and what your morning does to your day. When you dread getting out of bed, it colors everything. You stay in bed a little longer than you want to because you are delaying the moment of pain. You move less during the day because every transition between sitting and standing reminds you. You decline invitations. You stay home more. You walk shorter distances. And gradually, quietly, your world gets smaller. Not because of the knees, but because of what the knees do to your confidence and your willingness to move and your belief in your body. What the morning routine gives you is not just less pain. It is a different morning. A morning where you wake up and you know what to do. You warm the knees, you move through the sequence, you stand up the right way, and those first steps feel manageable. And manageable mornings lead to better days. Better days lead to more movement. More movement leads to stronger knees. Stronger knees lead to more confidence. More confidence leads to a bigger world. It all starts here in 2 minutes before your feet touch the floor. I am Dr. Chen, and I am genuinely honored that you spent this morning with me. Please try this tomorrow. Just try it once and see how those first steps feel. And if it helps you, if it gives you even a little more ease in those first moments of the day, please Please share this video with someone you love who also winces every morning. They deserve this too. Leave your questions and your experiences in the comments. I read every single one, and I will see you in the next video. Good morning, and take care of those knees. They have so much more walking left to do.